Hi, Selena. Hey, great to see you.
Good to see you too.
Hey, last time I saw you, I was just a resident. Now I'm a general practitioner. So guess what? I'll be overseeing your general conditions, your general health. If you need to see any specialists, I can take care of that. Any tests that needs to be ordered, any follow-ups or anything like that. How does that sound?
Sounds great. Did you realize you're wearing 2 different shoes?
Oh, really? What happened to my other sandal? Well, that's okay. Well, why are you here? Tell me, what's going on?
Well, I've been having these crazy headaches for days. Also been really tired and really sore. I thought it was just from staying up late so many nights studying for AP tests, but those happened weeks ago, and I've been getting plenty of rest since then.
Really? That's not like you.
Yeah, I just haven't been feeling myself lately.
Well, that's pretty weird. Anything else?
Well, I did have the chills, I guess. My mom gave me a Tylenol and they went away. I didn't think too much of it because I was too busy studying for AP tests.
Selena, come on. Let me tell you here. Your AP exams are really important and everything else, but so is your health. So you know what I think? It might be the flu or something like that at this time of year. So you know what I think you really need to do is try to get a little bit more rest. Make sure you drink lots of fluids and relax a little bit, as much as you can at this time of year. And what I'd like to do is call me in a week if things don't get better or they seem to get worse. Peace, love, rock on. Yo, Selena, what's up? You're back so quick?
Well, none of the symptoms from before went away, and now I have this disgusting rash on the back of my knee. Prom's in a couple days, and I can't have this showing up on my pictures. I mean, look at it.
Oh, I agree. Let me take a look at that. I don't know. Whoa, that's not cool. That's pretty gnarly. Whoa. Well, let's see. When did you first see that?
A couple days ago.
A couple days ago? And it's that bad? You know what? I'm going to have to send you to a specialist. So I have a dermatologist friend of mine that's really good. So I'm going to write up a slip and you can go over and see that dermatologist. They should be able to help you. Promise how long?
5 days away.
5 days away? Okay. All right. But, you know, since your symptoms changed, it might be that you picked up something else. Is there anything going around at school right now you can think of? Anybody getting anything?
Well, a few of my friends have had mono. I don't have that, do I?
Your friends had mono. Well, that's pretty common among high school students. It can really make you feel run down, the same symptoms you have. So, you know what? I'm going to send you for a blood test. It's really easy. Get the blood test done. They'll send the results back to me right away. Here's a slip for LabCorp. So you can just take that, write down to them. They'll do the test and send the results back to me.
Come in.
All right. Hi, Selena. I've been waiting to follow a visit here. How did your visit with the dermatologist go?
All right, I guess. He gave me a cream and the rash pretty much went away. You could still see it a little bit in the prom photos, but I just cropped them before putting them on Instagram, so it wouldn't work well.
Okay, well, I guess I definitely needed to know that. All right, so rash is going away and everything else, but, well, Selena. Selena, did you know something wrong with your face?
Excuse me?
Yeah, something's wrong with your face.
No, that's ridiculous. I've had
You haven't
that.
seen that? No, wait a minute, come back, really, take a look, get your phone, take a look. There's something wrong with your face. On the left side.
What is this?
Well, it looks like it's drooping a little bit and things like, you haven't had that before. You didn't see that today at all?
No.
Yeah, the whole left side of your face, like your cheek and right around by your mouth there, it's drooping a little bit. Here, have a seat. Come on, we have to see what's going on here. Let me see, I got some reports back here. Dermatologist gave you a good report. Said they gave you the ointment for the rash, and you said it's starting to clear things up. That's great. You went to LabCorp and got the mono test done, and the results are back, and the results are negative. But I don't like that drooping on the face. That has me concerned. I think you need to see a neurologist. I have a really good friend who's been practicing for a long time. He deals with this stuff, and he's the best one that's going to be able to help you with this right now. I have a slip. On the way out, stop at the desk. They'll get you the slip for the neurologist. We really need to see what's going on with that.
Come in.
Hi, I'm Dr. West.
Selena.
Dr. Nola sent me. I came as soon as I could. What seems to be the problem?
My face is drooping.
You're right. It sure is. I have Dr. Nolas's report right here. I've read through it all, so we're going to take a look at it. There seems to be some drooping on the left side, and it runs from the top of the eye to the bottom of the lip. I can't really say anything until we do a CT scan. Basically what that is an x-ray of your entire head, and I'm looking for any enlargement of the veins or the artery or any swelling in the brain. Simple stuff. Have you fallen and hit your head lately?
Oh, just been hanging with my friends.
Okay, great. Well, we'll get you started on that right away and see what's up. I'll let Dr. Noles know the results when I get them.
Thank you.
Okay, thank you. Take care.
But you know what, guess what? The CT scan came back and there's nothing on it, so that's clear.
Forget that. Look at my knee.
Your knee?
I have a scholarship to play volleyball in the winter.
Whoa, look at that knee. I never saw anything like that in medical school. But you know what? Your knee, that's definitely, when did that start?
A week ago?
A week ago, all right? Well, you're gonna get to know all my doctor friends pretty good, because I think now, since it's one of your knees, that's one of the joints, I think you're gonna need to go see an orthopedic. But these symptoms are changing as we go along. I'm not sure. You know, we will figure this out. Pick up one of the slips on the way out, and you'll see my orthopedic friend. Get there as soon as you can with that knee looking like that.
Yeah, I can definitely see the need. So yeah, I looked at your case report. So it started with, you said it's flu symptoms, and you had like fever, soreness, tiredness, all that stuff. And then it went to the rash, right? And you got that kind of treated, it looks okay. And then it went to the drooping face thing. Okay, it looks a little better, but I can still see. Anyway, so yeah, then you were negative for mono, and now we have this knee thing. So I'll be honest, I'm gonna send you for some physical therapy, some really light stuff, but honestly, I don't think that's the answer. Yeah, unfortunately. So what I'm thinking is, you know what? I think I'm going to. Oh my goodness! Excuse me, Selena. Someone's coming. Let me take this quick. Oh, it's your doctor. What in the world? Dr. K's calling us. Right? Take a look at that. Here, I'll put on speaker for you. Hello.
Hey, Dr. B, what's happening, man?
Well, it's the middle of the day. I'm actually with your patient, Selena, right now. You're on speaker, by the way.
You're with Selena? I was just thinking about her case. I'm down at the grocery store, and I'm shopping, and I'm going through the produce, and I'm seeing Lyme. And I'm thinking, Selena? Lyme. And I think that's what it is.
Wait, what? Is everything okay?
I think it's Lyme disease.
Lyme? Oh my goodness. You know what? I think you're right.
Really? You think the symptoms add up?
Well, I mean,
What's going on in the knees?
it wouldn't hurt to test it out, right? We could do a Western blot.
I think what we should do is write her up a script immediately to go get a Western blot test, because that's the definitive test for Lyme disease.
That is
We need to get
perfect.
that done right away.
The Lyme results test came back, and it's definitely Lyme disease, which is caused by a bacteria, Borrelia burgdorferi. It's transmitted through the bite of a tick. Have you been in the woods at all, or Any trips during the AP times you didn't remember or anything like that?
Well, don't tell my mom, but some friends and I went to the beach for a study break one day, but don't get taken to the beach.
Well, no, it could be because they're all over the place. And especially during the early part of the spring, the baby ticks are really small, so you could have had one and you never saw it. Let's take a minute and review the symptoms that you had in this whole progression of this Lyme disease condition. When you first came in, you were showing fatigue, you had muscle aches, and you had headaches. And this was your body responding initially to the infection when you first got it. This was your innate response of your immune system. On your next visit, Selena, you came in and you had that skin, that rash on the back of your knee. Well, that was your integumentary system also responding, showing that rash on the back of your knee. Continuing on, then you came in and you had that drooping of your face, which was the facial palsy, and this was affecting your nervous system. So now the Lyme disease was affecting some of the nerves that supply these muscles around your face. Some were being destroyed and some were being sort of rendered inoperative where they weren't working correctly, and those muscles were drooping on your face. And then after that, if that wasn't enough, Selena, then you came in and you had dem knees. Your knee was swelling, it looked pretty bad, and this was where it was now beginning to affect your skeletal system. Now the way this worked was part of your adaptive response. Your body was producing antibodies. The antibodies were directed toward an antigens on the bacteria, but at the same time there was a very similar antigen on your joints, on the cells in your joints, and it was cross-reacting, and those were becoming inflamed and swollen, and this was what you were seeing in dem knees.
Let's get you going on treatments before you go to college. We're going to first start you off on an antibiotic called doxycycline, 200 milligrams. And we're going to administer it intravenously right here in your vein. That should have you feeling better in no time at all.
On the treatments, we're going to go in with an antibiotic, doxycycline. Right? This is going to help treat the bacteria itself. Now, we can also use some anti-inflammatories to help your knees to settle down that inflammation. This will help out a real lot with everything else. All right, what do you think?
Sounds good.
Sounds good? Okay. Now, if we need to give you some sleep meds or something like that, or maybe to have some acupuncture treatments or some physical therapy, we can definitely do that. Anything to help you progress through getting better after all this happens. And you know what? If all else fails, I think you need to take a nice little vacation. What do you think? Because you're going to get better. Selena, it's been great following through on this. I can't wait for you to go to college.
And I can't wait for you to put some shoes on.
Oh, thank you.
That's all empty and I don't care. So my baby down by the river, you should have to come up soon for there. Sweet blossom, come on, under the willow. We can have high times if you look back. We can discover the wonders of nature.